Diabetes, osteoporosis, heavy smokers, patients on bisphosphonates, cancer-related bone loss. These are the patients where we hesitate or where we place the implant and hope the biology cooperates. Here is why the MED changes the risk profile for every one of these cases. The common thread in all high-risk implant cases is the same: impaired bone formation in an inflammatory environment. In diabetic patients, elevated glucose impairs osteoblast function and increases TNF-alpha. In smokers, vasoconstriction reduces blood supply to the implant site. In osteoporotic bone, the trabecular architecture is already compromised before the implant is placed. Standard passive healing asks bone that is already struggling to do more than it can. The critical finding from a study in Scientific Reports is this: PEMF drives mesenchymal stem cells toward osteoblast differentiation even when TNF-alpha is elevated. That is not a normal healing condition. That is exactly the environment inside a diabetic or post-radiation patient. By increasing VEGF, PEMF compensates for the reduced vascularization in smokers. By stimulating osteoblasts directly, it compensates for the impaired cellular function in diabetics. By increasing trabecular bone density, it improves anchorage in osteoporotic bone. A study in Materials showed a 62% increase in trabecular bone volume density in PEMF-treated implants versus controls. In compromised bone, that difference is not cosmetic. It determines whether the implant stabilizes. The protocol is identical to standard MED placement. The device goes in at implant placement, activated, torqued to 10 Newton centimeters. In moderate to severe inflammatory conditions, which includes many high-risk patients, 2 consecutive MEDs over a 60-day period are recommended to maintain continuous PEMF stimulation through the full healing window. Restoration timing: mandible at 30 days, maxilla at 60 days, consistent with the studies. The patients you hesitate to implant are often the ones who benefit most from active healing support. For the full documentation